Diluents. The patient should drink, between meals if he is dyspeptic, about 8 glasses of water a day. Ordinary drinking water suffices, but if he can afford it and it does not prove too diuretic, an alkaline diluent such as Vichy Celestine is preferable. But here again, common sense must temper routine practice. In acute gonorrheal cystitis and in very acute posterior urethritis, more harm may be done by the muscular straining attending the frequent repetition of the urinary act than is atoned for by any amount of dilution of the urine. Internal medication. The drugs that may be effectively exploited to combat acute urethral inflammation belong to 5 orders. 1. Urinary antiseptics. 2. Alkalies. 3. Demulcents. 4. Anodynes. 5. Balsamics. 1. Urinary antiseptics. Urinary antiseptics such as hethamethylenamine, methylene blue, Salol, benzoic acid and the benzoates, boric acid and the borates have no recognizable influence upon urethral inflammation. Theoretically, they ought to be of paramount importance, but practically, these substances, so valuable in suppurative conditions of the urinary tract above the bladder, are useless below that point, whether because their bactericidal efficiency is slight or because their sojourn in contact with the inflamed urethral wall is limited, or because the bacteria are shielded from the antiseptic action of the medicated urine by the tissues in which they lie. The value of hexamethylenamine and of methylene blue in acute gonorrhea has been vaunted. In my opinion, it is slight, so slight that it does not deserve consideration. Yet, hexamethylenamine is very useful to protect the kidneys. It should be given whenever there is an unexplained rise of temperature in the course of a gonorrhea. 2. Alkalies. The virtue of alkalies in the treatment of urethral inflammations depends rather upon the condition of the urine than upon the grade of the inflammation. The urine, normally acid and often dense, is, ipso facto, harmful except insofar as it washes the urethra, and the alkali is negatively a very good thing, but good only when required to counteract acidity. In other words, there is no specific action whatsoever in the alkalies. They do not in the least control suppuration. If one had 2 burned hands and placed one of them in vinegar and water and the other in a watery solution of bicarbonate of soda, he would doubtless prefer the sensations experienced in the hand immersed in the mild alkali. And so it is with the urethra. Patients having normally bland, alkaline, dilute urine, and there are many such, stand in no need of alkalies and, indeed, may occasionally be injured by them through indigestion. When the urine is acid, an alkali is indicated. If the urine be also dense, a diuretic alkali is called for. If dilute, specific gravity 1.015 or less, the diuretic quality is not needed. Alkalis produce the greatest effect relative to the size of the dose, if administered toward the end of the 2nd hour after eating. Bicarbonate of soda. This is the mildest of the alkalis. Its chief virtue is that it aids digestion, while the other alkalis impede digestion more or less. Dose 0.5 to 1 gram. It is prescribed in the form of tablets. Sweet spirits of niter. Spirits Aetherius nitrosi. Sweet spirits of niter is notable for its anodyne rather than its alkaline properties. It is chiefly employed for the slight irritation of the bladder, so common in women. Dose 2 to 6 grams in water. Potassium citrate, potassium acetate, liquor potasse. These 3 salts are employed more than any others as urinary alkalinizers. The citrate is the most efficient as an alkali, but irritates some stomachs. The liquor, the most anodyne, the acetate, the most diuretic. Therefore, the liquor is most useful in acute cases, and the citrate in chronic cases. The acetate is a stronger diuretic than the citrate, but I have found it also more irritant to the stomach. The dose of each drug is about 0.5 grams in a considerable quantity of water. The disagreeable taste is well disguised by syrup of cinnamon. Bromide of potassium. This acts as an alkali and is sometimes efficient in controlling the smarting upon urination.